All right, Dr. Murrell, thank you so much for being here. If you could please tell me your name, your title, and where you work.
Yes, my name is Dr. Zaria Murrell. I work at Huntsville Hospital and I am a pediatric surgeon.
Okay. Tell me a little bit about your job. What does your day-to-day look like?
Ooh, that it varies from day to day, but it's usually pretty busy. So you want the beginning, like how I just start my day, or just the work part of it?
Let's do work in general, just a general overview. I know you said it changes every day, but a general overview of what someone in your position might be able to expect.
Absolutely. So on Monday, Wednesday, Fridays, typically I'm in surgery most of the day. I can do anywhere from 4 to 10 surgeries in a day.
Wow.
I usually have scheduled surgeries, um, which I do first thing in the morning, whether that's hernias or circumcisions or removing lumps and bumps. Sometimes I may have a more complicated case where I only schedule one case for that day. Sometimes babies are born with their intestines outside their body. That's called gastroschisis. Usually, I do those kind of things at the bedside in the neonatal ICU. Sometimes babies are born with what's called imperforate anus. That means they don't have an opening to their anus, and I have to create one and give them a new butthole so they can poop. Uh, Um, but either way, whether I'm doing 4 small cases or one big case, that's usually what I do on Monday, Wednesday, Friday. But then I get calls throughout the day. So I may get called for a kid with appendicitis. Sometimes I guess since are stuck in them and they can't be reduced, they can't be pushed back inside. So those are more emergent cases. Um, Sometimes I have young ladies whose ovaries are twisted, so I'll fix that. There's just a variety of cases that I see.
Sounds
And
like
then on Tuesday, yeah, it's busy.
it is. It is. It sounds like you're a Jane of all trades and like you're really helping a lot of people. That's pretty incredible. It sounds like your breadth of knowledge is wide ranging.
Yes, it's one of the few areas in general surgery where there's a wide scope when it comes to pediatric surgery. Sometimes we have children who are born without their esophagus attached to their stomach. That's called esophageal atresia. So I'll operate in their chest. Um, we have kids, it's been a really bad flu season. So lots of kids with pneumonias, and I have to go drain the pus out of their chests because the pneumonia makes a fluid collection and it makes it very difficult for the children to breathe. And it looks like a whole bunch of cobwebs with pus and fluid trapped in there. So I will often have to go in and break up the cobwebs, suck out the fluid. Um, yeah, it gets crazy sometimes. So, and then so that's Monday, Wednesday, Friday. And then on Tuesdays and Thursdays, I typically will see patients in the office. We
Okay.
usually have clinics both in the morning and the afternoon. Um, but then, like this morning, I had a patient whose parents are only, the father is only off on Tuesday. So I just did a surgery. I literally finished at 9 a.m. and just walked over to be able to get this interview done. And then again, even though I may be in clinic on Tuesdays and Thursdays, I will still get phone calls for kids with appendicitis or a baby in a NICU who's critically ill. And so I have to kind of squeeze them into the day. So we just make it work.
Yeah, absolutely. Well, thank you for making time for us. I know how busy you are. So I want to
Sure.
ask you, of the letters in STEM, science, technology, engineering, and math, which letter or sequence of letters do you think most applies to your job and your role?
So I would definitely say the sciences is probably the primary area, but then M for mathematics is also very important because in pediatric surgery, everything is based on weight. So we're doing calculations all the time to adjust the medications, whether it's the antibiotics or pain medicines, everything is based on a patient's weight. So we're always doing calculations to make sure that the patient gets the exact dose of medicine that they need.
That's awesome. I don't know that I would have thought of that before. And I imagine,
Mhm.
honestly, just sitting here talking to you, I imagine technology is a large portion too. I'm sure some of the tools you use are quite state of the art.
Absolutely. So we do a lot of laparoscopy. So that's using fiber optics and light to project everything on images on the television screen to do our surgical procedures. And then we often use staplers for taking out appendices. So yes, there's a lot of technology involved and just all the different equipment that we use. It's very fine-tuned and you have to know all the names for all the instruments. This is not something that I do by myself. I have an amazing team. I have nurses, nurse practitioners, OR technicians, and anesthesia people. They all work together with me to make sure we have the best outcomes for the patient.
Yeah, that's wonderful. Well, look at you. You're 3 for 4 on the letters of STEM. That's pretty impressive.
Yeah, it is. It's pretty cool. I get to see lots of amazing things every day.
It sounds like it. So walk me through what type of schooling and what type of degree it took to get you to this point.
Sure. So I went to college for 4 years, and then I went to medical school for 4 years. And then I did a surgery residency. So general surgery residency is typically 5 years. And then to get into pediatric surgery, it's extremely competitive. So a lot of us, while we're in our general surgery residency, we do 1 to 2 to 3 years of research. So I did 2 years of research. And then typically afterwards, you go into a fellowship, which is specializing in pediatric general surgery.
Yes.
And that's an additional 2 years.
Oh, girl, did you get out last month?
Hmm.
That's a lot of school.
It is a lot of schooling, but believe it or not, I graduated from medical school 30 years ago. So I've been doing surgery for 30 years and I love it.
Well, congratulations. Okay, so let's run with that.
Yay.
Why did you choose this career? I mean, that's a lot of school. You're a very educated woman. What made it worth it for you? What made you say, this is what I'm going to do and I'm going to love it? What kind of hammered that home?
So actually, I was a gymnast in high school, nothing really competitive, but I still fell in love with gymnastics as a teen. And so I thought I was going to medical school to do orthopedic surgery and to do sports medicine.
Mhm.
It's really in medical school where you have an opportunity to experience all the different disciplines. You rotate on internal medicine and OBGYN and general surgery, neurology, ophthalmology. You get to see it all. And so I honestly fell in love with pediatric surgery as a third year medical student. And when I got to see the kids that they operated on, I just totally fell in love with it.
That is wonderful. That's wonderful.
Hmm.
So walk me through some of the challenges that you face. What are some things that hit your desk or hit your operating table that you have to resolve at work every day, where you have to show resiliency and problem solving?
Sure. Just dealing with really, really tiny children. I operate on babies who are premature. Unfortunately, sometimes part of their prematurity causes problems with their intestines and how they work, and they get really bad infections in their intestines, or they may get holes in their intestines. So they have leakage of intestinal contents, which makes them extremely sick. And many of these babies are very, very small. I'm talking 1 pounds, 1.5
Wow.
pounds, and we have to operate on them sometimes even at the bedside in the neonatal ICU because they're too ill to be transported to
Oh
the
my
operating
goodness.
room. Sometimes when they're even still very ill, sometimes they're on a breathing machine that vibrates so much that I cannot do the surgery at the bedside. So then we have a whole team of people that transports them down to the OR. And it's got its own challenges, just moving a baby from the neonatal ICU, getting on an elevator, coming downstairs, pushing them down the hall. So it always requires a team of people. I always go with the patient, especially when I'm taking them from the operating room back to the ICUs to make sure that communication is given to the staff that's going to be receiving the babies
Mhm.
and make sure that they understand what I did and how to optimally care for the patient as they recover.
Absolutely. I'm so glad you touched on that. You know, you are a pediatric surgeon, but you're so much more than that, right? You said you're, aside from just STEM, you're a communicator. You're someone who I'm sure is
Mhm.
asked to comfort a lot. You really have a lot that you get to do in your career. I
Yes,
think,
yes, yes. And I'm very close to a lot of the parents, especially when their kids have been critically ill and they've come out on the on a great side. You get really close to them after you spend a lot of time talking to
I'm
them and
sure.
explaining the disease process to them. And then they become your friends, and then you go to the child's first birthday party. It's
Oh,
really quite fun.
how sweet. I love that
Yeah,
story. So
yeah.
I think I know the answer to this, Dr. Murrell, but would you choose your career all over again?
Absolutely, 100%. I know that it's challenging. I mean, I love what I've been able to learn and see and participate in over the years. I know for me, just I'm married, I have a husband and children, and it's been challenging for them, but they
Sure.
they know that their priority still, whenever they call, I take, even when I'm operating, I will pause to take a call,
Yes.
especially if my kids call. So they know it's important. When my kids were little, they used to say, "Mommy, aren't you tired of taking out kids' appendices all the time?" But they understand that everybody's slightly different. It's not exactly the same every single time. There's always some slight variation. That's what makes us each unique.
Yes, absolutely. And I really like how you touched on the work-life balance there. I do think that's so important. I don't think we have to be women that choose a career or choose a family. I think we can definitely do both, and you're living, breathing proof of that.
Yeah, I always tell people you cannot pour from an empty cup. So, like what I was saying, when I start my day, it's me, meditation, spending time with God, praying, and then I go to the gym. I work out almost every single day of the week
Good for you,
because
girl.
cannot pour from an empty cup. So, if I don't fill my cup up first, if I'm not healthy, if I don't eat good, if I don't drink plenty of water, then I'm not at my best, and I can't give my best to my patients.
That is a great message. That could be an interview all in of itself. Well, I know how busy
Yeah.
you are. I want to let you get back to work, but before you go, I want to ask if there's young girls or just young students in general who think they might be interested in a career in medicine, a career in surgery, pediatric surgery, what would your message to
Mhm.
them be?
Oh, there's so many great venues. Well, you're always welcome to come and shadow me. I know that the hospital tends to have some restrictions when it comes to ages of people that can shadow. Usually high school students can. But I do know that like there's a program in Birmingham where students are allowed to be a doctor for a day and they can watch the surgeons and go around and do that. I would love if we could do something like that in Huntsville. But even if your parents have like take your daughter to work day or something like that, see if you can get a friend of a friend to get you in to follow us around. But yes, there's always programs in the community. And then you can always call my office if you want to just come and see what I do in the office. You're always welcome.
Thank you for that. That's awesome. Dr.
Hmm.
Murrell, thank you so much for your time. I know how
Yeah,
busy
thank
you
you.
are. This was
Yes,
amazing.
thank you.
Have
I'm
a
glad
great
to
day.
help and I appreciate it. All right, you have a wonderful day. Thank you.
Thank you.